Welcome back. We are in Studio B now, and if you didn't know, today is the deadline if you're looking to secure healthcare coverage through Covered California. So joining us in Studio B today to talk about how to navigate those steps of getting started is Marisol Guillen with Dignity Health. How are you today?
Doing good, thank you.
Good
morning.
Yeah, thanks for coming in. So we have a lot to get started with today. First of all, the push for this is coming on the heels of some federal changes regarding Covered California. Tell us a little bit about what's new.
Yeah, so the major change for Covered California is that there's no longer that penalty. So if people that don't want to sign up for health coverage, they won't be penalized for next year's tax income.
Right, so there's no longer a fee, but you were saying before there might be some negative impacts of people not necessarily being required to have health insurance.
Yes, for example, I mean, a lot of those young adults that feel healthy, that there's nothing wrong with them. They don't see the need for the health insurance. But the open enrollment is the only window they have to sign up. So right now they're healthy, but we don't know if there's an accident that happens or if they get sick down the road in the year, you know, so there's no other options for them to sign up. So it's always best to have health insurance and just be covered because life happens. You know?
And I know you were saying that could also affect wait times at emergency rooms. How does that work?
I mean, it could possibly negatively impact because a lot of people are not going to have health insurance, so their only resort is going to go to the emergency room. You know, they're not going to have those preventive health visits with the primary care physician. So that is one of the negative impacts of not having health insurance.
So we know there are 1.1 million people across the state who are eligible for Covered California but have not yet signed up. So with today being the deadline, are there any other opportunities in the future for them to sign up, or what would happen if they don't get there today?
Yeah, so the open enrollment window ends today, and that's the only deadline that they have. There's other chances for them to qualify, but it's only if they have a qualifying life event. And those are just for some examples, like, you know, having a new baby or getting married or divorced. For those young adults that are right now in parents' health insurance plan, once they turn 26, they can get their own plan as well. So those are the only some of the options that they have after this open enrollment window.
And I know you were saying there's some misconceptions. Dignity Health wants people to start looking for a doctor first rather than a plan and then going to a doctor that their plan allows. How does that change kind of work for you guys?
I mean, it's more of the education going out to residents. We really want them to feel comfortable with their doctor, and Dignity Health recently had a survey in which more than 85% of California Latinos said that they feel comfortable with the doctor, but they choose their health plan first and then the doctor. And we are really encourage everyone to do the opposite, to choose a doctor so that they can feel comfortable with them and then choosing a health plan.
Right. All right. We are almost out of time. Really quickly, for people who have more questions or they just want to get started with signing up today, where can they go for more information?
Yeah, they can go to our website, www.dignityhealth.org/enroll, or they can give us a call, 661-632-5018.
All right. Marisol, thank you so much for joining us this morning. Let's send it over back to Mike in Studio A.